Okay, I'm recording. Hi, everybody. Bob Lazaro from All Things Leland. As you've heard me say in the past, Brunswick County, sixth fastest growing county in the country. By median age, Brunswick County is the oldest county in North Carolina, and we live in the seventh fastest growing region in the country. With that growth is demand for services, and certainly one of them is healthcare services. I'm pleased today to have a conversation with Steve Smoot, who's the Executive Vice President and President of the North Carolina and Georgia divisions of Advocate Health, which works cooperatively with Atrium Health, who have submitted a certificate of need application to bring new hospital beds to New Hanover County and the region. So, Steve, thanks for joining us.
My pleasure. It's great to be with you, Rob.
Hey, let's get right to it. I mean, Atrium Health is applying to build a new hospital in the Wilmington area. What's your thoughts behind that? And as a follow-up, I know you're only requesting 42 beds. How does that work with your model of providing healthcare services?
Yeah, wonderful questions. I appreciate that. First of all, you said it in your opening, fastest growing part of one of the fastest growing parts of the country, one of the fastest areas growing in the state. You're a great example of that. People looking for a nice place to live as they're migrating south, but not too far south, and we're seeing that happen quickly.
Mhm.
We've had a strong presence in this community. This isn't us looking to come in here for the first time. We've been in this area for nearly 2 decades.
Okay.
We manage the Columbus Hospital right now since 2007 and their medical group. But some may be surprised to learn that from 2009 to 2020, we actually managed the New Hanover Physician
Okay.
Group and actually grew them into a group of nearly 200 wonderful physicians in that community. So we have a long-term presence, know this community well, and our hearts are there. And so as we've watched it grow, and the state facilities plan came out with the need for 225 beds, we felt like the time was right for us to enter into the market. And the other piece, as we analyze this, and I know you've got expertise in healthcare, so you'll appreciate this. It is also the largest or second largest, I've had both said to me,
Okay.
metropolitan area with only one provider. And it's neither here nor there. It's just what's happened as it's grown so fast. We're a firm believer that competition is healthy in everything, but especially in healthcare, provides better cost, quality, and service when you've got a competitor to keep you honest as you're in that market. So that's driving us as well as we want to help deliver the highest quality care to our patients that we feel some loyalty to in that market. And a final thing I'll add on that, and then we can touch on the 42 beds. A lot of this was a reach out from the community. We've had hundreds of physicians, providers, APPs, community leaders, and patients that have encouraged us to come back into the market in a bigger way and hopefully build a hospital in this community. And so, all of that was just overwhelming pressure in a good
Mhm.
way for us to want to put our hat in the ring and apply for the beds. Um, you want me to jump to the 42?
Yeah, I mean, for those who've seen the previous videos from the two other applicants, Novant is asking for 225 beds. UNC Health is asking for 150. You all are asking for a smaller amount, but then again, I understand that's the model of how Atrium works.
Yeah, and specifically, my understanding is where the other two locations are going is down in the heart of the population that is there now with New
Mhm.
Hanover. And we've had a really strong track record of going where we believe the population is growing and then growing with it.
Okay.
There's evidence of that. Our Lake Norman, Union West, Greensboro, and other places around the state and around the country
Okay.
where we think it's fiscally responsible to go in conservative, develop the
Mm.
services, and then we'll grow from there. But 42, I was going to add this too, Bob. 42 beds is not a small hospital
No.
anymore because so much has moved to outpatient services. We are bringing a full service hospital into the community. And so we're confident we'll be able to provide great services to that community and then eventually grow as the community grows. We're out on the north end of New
Right.
Hanover where the growth is coming, and we want to be there and grow with it.
I think that's an important distinction that you talk about. the size of the hospital in terms of how the medical care system has changed over time. A lot of people are going to will ask the same question if approved by the state. And just so viewers know, certificate of needs applications are not unique to North Carolina. There are 30 plus states that have such a administrative review. So if you're approved, what is your look at a timeline for this, Steve?
Yeah, it sounds like you've already discussed this. So the approval should come out late November of this year in
Okay,
2026. Assuming we get that approval, we'll start even more earnestly on the process after that and plan to open January of 2032. Now, that sounds like a long ways off, but in the meantime, there's a lot that will happen. We'll continue to develop our outpatient presence, our physician presence, any services that we can provide in anticipation of the opening of the official hospital we'll be working on between now and then. But it takes time to plan, develop, and put
sure.
that hospital together. And so 2032 of January, bottom line.
I mean, physician recruitment is a big deal. Plus, then you have to hire all of the supporting staff. My own spouse was a unit secretary in Nova Loudon for several years ago, and so I know how big of an organization is needed to support the men and women who are providing medical care. When one of the things that struck me in taking a look at the announcement by Atrium is your specialization in cancer care and how important that is as people are living longer. Obviously, cancer has infected my family and most others. I mean, what is your presence in that field?
Yeah, we are one of the premier providers with our Levine Cancer Institute. It's actually one of the few recognized comprehensive national cancer institutes by
Okay.
Health and Human Services in the country. We have had a habit of and a plan because of who we are as a system. We're not concentrated in just one community. So while that's anchored around Wake Forest, Baptist, and Charlotte, we have always tried to bring services closer to home. In fact, one of the big steps we just announced and made this year is our national service line approach, our
Okay.
national clinical trials part of that, where, and bottom line, it used to be, Bob, if you got cancer and it was something rare and unique and you wanted to have the latest research being done and the latest treatments provided for you, you'd have to go somewhere.
Yeah.
Back in the day, you'd go up to Washington, D.C. and to
Hmm.
Baltimore and to some of these other places.
Sure.
We now have the ability, wherever possible, and in most cases, we can bring that right to New Hanover and provide the care to the patients there. Have a relationship now in Columbus with our Denary Cancer Center, which
Okay.
was our first to come into that network,
Okay.
and we would just expand on those services down in that community.
Super. My dad died from cancer 46 years ago. Back then, it was either they gave you brand X or triple X. There was very crude
Exactly.
treatment, and now it's changed tremendously. One of the other things that I think folks need to understand that hospital organizations do involve themselves in charity care, and Atrium has a strong record in that area. Perhaps you could just touch upon that a little bit.
Yeah, thank you. We are actually the largest provider of Medicaid and care to the uninsured in
Okay.
the state of North Carolina, and one of the largest providers in behavioral health as well, which is coupled with all of that, unfortunately. We have very generous charity care policies. It's been core to our mission. We have a mission that's make sure that we care for all.
Hmm.
And while in 2024 we did $2.5 billion worth of charity care,
Okay.
6 billion system wide. Those numbers are big, but what does it mean to an individual? And I always love this story, and it's something I'm proud of that we're able to deliver on. We provide charity care to anyone that's at the 300% of the poverty level. And to put that into perspective, if you're a family of four, your income could be upwards to $100,000 and you won't get a bill from us
Okay.
because that's the level of care. Now, you and I are of an age that 100,000 sounds like a lot. Unfortunately, it's not as much as it used to
No,
be, but we're sensitive to what that means for families and provide very generous policies and then have sliding scales beyond that.
sure.
Yeah.
Listen, I'm sorry. You gonna,
No, that was it. Go ahead.
I interrupted you. I want to thank you for your time. I think is really important. For those who are watching, public comment is open through the end of July via email, and I've shared that email address several times. And then there is an in-person public hearing on August 20th at the Arboretum in Wilmington for folks to weigh in. I'm sure Steve and you and your team will be there. I hope to stop in and take some notes and meet you personally. Again, thank you for your time. I appreciate it. To my viewers, thank you for joining us. You always can sign up to the blog. It's for free. Steve, have a great day.
Robert, thank you. It's so nice to meet you.
Same
Appreciate it.
here.